Hello everyone, welcome to Vasomeditech EECP Treatment Center. Today in this video, we are going to talk about 3 myths which are in the cardiology which every patient should know and should understand. Myth number 1 is if you have a chest pain or a mild change in your ECG or your treadmill is positive, even if you are asymptomatic, if your doctor is asking you to go for an immediate coronary angiogram, this is a myth. Why? Because many patient thinks, of course, my doctor has explained to me clearly that he has to see the block so that I could get a good treatment. Is it true? No. Is it not true? I mean, there are other colleagues like cardiologists. Let us look at your gastroenterologist. No gastroenterologist will claim if you go for a symptom with ulcer, he may suggest to go for an endoscopy immediately so that he can say, I have to look at your ulcer before I treat your ulcer. No, he started treating you right away and most of the patients get better and they don't require endoscopy at all. But again, many of you would argue, well, that's just an ulcer, but here we are talking about the heart disease which has an emotional attachment. But even ulcer could be dangerous because your gastroenterologist can still say this ulcer can perforate, it can bleed you to death. But they don't scare you that much. They simply give you a treatment and most of them get better. If you still have a doubt, let's look at your another colleague, your endocrinologist. Now, the number of stroke is almost equal to number of heart attacks. But how many of you have known that your neurologist have advised you to go immediately for a cerebral angiogram and put a stent in your cerebral artery? No, it's very, very rare. So somehow your neurologist know to treat the blocks without seeing the block and many patients get better. But the cardiologist somehow doesn't know how to treat. But that's why it is called a myth, because most of the patient, as guideline indicated, don't require an angiogram right away when they have a treadmill positive or when they have a symptom, and if they have a mild symptom and only have mild chest pain. Now, if you think, yes, what it is okay that I would undergo one coronary angiogram anyway because I trust and I still want to look at my blocks. Now, this is dangerous most of the patient because the risk of coronary angiogram many times in asymptomatic patient is much more than the risk of getting a heart attack because of the disease itself. So, to go for a coronary angiogram itself, you have to be very careful. So, if you undergo a coronary angiogram, then the myth 2 will comes to play. So what is the myth 2 in cardiology? This myth is, as soon as I see the blocks in a coronary artery, then the only way to treat you is to fix the block. Either I have to do an angioplasty immediately, or I have to do a stenting immediately, or I have to go for a bypass surgery immediately. Now this is be very dangerous because patient would have been panicked now because they might say, I just want to see the block, but why my doctor is now saying I have to immediately go for an angioplasty or a bypass surgery? Now this is actually a myth because most of the blocks seen by the cardiology, which is considered to be very critical or seems to be non-critical, it's not just an idea or a proposed concept. It has been already proved in various research, and I would quote a study called FAME. They have shown many of the blockage which looks critical in fact are not critical. That is why patients with even a blockage about 70 to 80%, they would not have any symptom. The pumping function is normal, their ECG is normal, and they are able to do all their activity without any discomfort. Now, what is the myth 3? Now, if you don't accept the cardiologist claim that you have to go for a bypass or angioplasty immediately, then the myth 3 is thrown at you. Now what you would hear from them is, if you don't fix the block immediately, your days are numbered, or you may die anytime very soon, maybe a couple of weeks or a couple of months or even couple of hours. Now this is also a myth because if you are asymptomatic, your doctor should treat you with medical management and there are various other methods to treat your blood flow, to treat your heart to increase the blood flow, like your medication, lifestyle changes, EECP. These are all conservative management which doesn't involve any risk. So most of the patient can undergo this treatment and can get well. Now, what is my risk? As my doctor said, if I have not gone for a bypass or angioplasty, and why it is called a myth? Because many studies have shown people with block, they don't have to rush to go an invasive procedure. Mean yearly revascularization procedure when you are healthy, it's not a good idea. Your interventional procedure will play a role in reducing the risk of heart attack and prolong your life only when you are very risk and you have exhausted all the option. So many studies, like I would try to quote some studies here so that it is a myth, it is not just an opinion. Studies like ischemia, courage have clearly shown in patient with coronary artery blockage, managing conservatively is equivalent to going for an invasive procedure, or it is much better than the invasive procedure. So any patient who have a heart disease should know about these three myths, and they have to take multiple opinion before going for a highly invasive interventional procedure which may almost change their life forever.